Fat Ass 45 reports no symptoms, so he returned to downplaying the virus as usual. Fat Ass 45 said to be making progress in his recovery from COVID-19, tweeted his eagerness to return to his Klan rallies, even as the outbreak that has killed more than 210,000 Americans has reached ever more widely into the upper echelons of the U.S. government. As Fat Ass 45 convalesced out of sight in the White House on Tuesday, the administration defended the protections it has put in place to protect the staff working there to treat and support him. Fat Ass 45 again publicly downplayed the virus on Twitter after his return from a 3-day hospitalization, though even more aides tested positive, including one of his closest inbred advisors, the white supremacist Stephen Miller. In one significant national coronavirus action, Fat Ass 45 declared that there would be no legal action before the election on economic stimulus legislation, an announcement that came not long after the Federal Reserve Chairman said such help was essential for recovery, with the nation reeling from the human and economic cost of the pandemic, and stocks fell on the White House news. As for Fat Ass 45's own recovery, his doctor, Navy Commander Sean Conley, said in a letter that the Fat Ass had a restful Monday at the White House and reports no symptoms. Meanwhile, Fat Ass 45 was grappling with the next political steps exactly 4 weeks from Election Day, which is now 3 weeks, anxious to reject strains which he doesn't show any. Fat Ass 45, who was still contagious with the virus, tweeted Tuesday that he was planning to attend next week's debate with Democratic Joe Biden in Miami, and that it will be great. That's what he claims. But yeah. Biden, for his part, said that he and Fat Ass 45 shouldn't have a debate as long as the Fat Ass remains positive with the COVID-19. Biden told reporters in Pennsylvania that he was looking forward to being able to debate him, but said we're going to have to follow what they call strict guidelines. Elsewhere in the government, the scope of the outbreak was still being uncovered. On Tuesday, the nation's top military leaders, including the chairman of the Joint Chiefs of Staff, which was General Mark Milley, and the vice chairman, General John Hyten, were in quarantine after exposure to Admiral Charles Ray, the commandant of the Coast Guard. Um, it was not known how Ray contracted the virus, but he attended an event for military families at the White House on September 27th, and the Coast Guard said in a statement that Ray felt mild symptoms over the weekend, and he was tested on Monday. Also testing positive Tuesday was the white supremacist Miller, a top policy advisor and 45 nutlicker who has been an architect of the Fat Ass's restrictive immigration measures. Miller's wife, Katie Miller, who serves as a communications director to the vice squatter Dumbass Pence, and had the virus earlier this year. She had been in Salt Lake City with Dumbass Pence, where he was preparing to debate the Democratic vice presidential nominee Kamala Harris, but she left as soon as she found out about her husband's diagnosis, officials said, but she tested negative on Tuesday. Fat Ass 45 on Monday made clear that he has little intention of abiding by the best containment practices when he removed his mask before entering the White House after his discharge from Walter Reed National Military Medical Center. Waiting aides were visible when he entered the Blue Room without a face covering. Fat Ass 45's attitude alarmed infectious disease experts, and it suggested his own illness had not caused him to rethink his often cavalier attitude toward the disease, which has also infected the first skank and more than a dozen White House aides and associates. Republican Senator Susan Collins said Tuesday, when I saw him on the balcony of the White House taking off his mask, I couldn't help but think that he sent the wrong signal, which he always does, given that he's infected with the COVID-19, and that there are many people in his immediate circle who have this virus. Fat Ass 45, for his part, falsely suggested that the virus was akin to the seasonal flu. Many people every year, sometimes over 100,000, and despite the vaccine, die from the flu. He tweeted, "Are we going to close down the country? No, we have learned to live with it, just like we are learning to live with COVID, and most populations far less lethal. In fact, COVID-19 has already proven to be a more potent killer, particularly among the older people, than seasonal flu, and it has shown indications of having long-term impacts on the health of younger people's effects. The Centers for Disease Control and Prevention estimates that influenza has resulted in far fewer early deaths than Fat Ass 45 said, between 12,000 and 61,000 annually since 2010. But Fat Ass 45 was working out of a makeshift office space on the ground floor of the White House residence. in close proximity to the White House Medical Unit's office suite. With only a few aides granted a face-to-face audience, the West Wing was largely vacant, as a number of Fat-Ass 45's aides were either sick or quarantining after exposure to people infected with the virus, or otherwise working remotely as a precaution. First, Skank Melanoma was isolated upstairs in the White House. On Tuesday, her office released a memo outlining extensive health and safety precautions that have been put in place in the executive residence, including adopting hospital-grade disinfection policies, encouraging maximum teleworking and installing additional sanitation and filtration systems. Resident staff in direct contact with the first family are tested daily, and support staff are tested every 48 hours. And since the Fat Ass and the Skank tested positive, staff have been wearing the full PPE stuff. Despite Fat Ass 45's upbeat talk about the disease, his own treatment has been far from typical, as his doctors rushed him onto experimental antiviral drugs and prescribed an aggressive course of steroids that would be unavailable to the average patient. On Tuesday, he was known to receive his final dose of the antiviral drug remdesivir. It was not known whether he was still being administered the powerful steroid dexamethasone, which was prescribed Saturday after he suffered a second drop in his oxygen levels in as many days. But Dr. Conley said Monday that because of Fat Ass 45's unusual level of treatment so early after discovery of his illness, he was in uncharted territory, adding that Fat Ass 45 would not be fully out of the woods for another week. The coronavirus can be unpredictable, and Conley has noted it can become more dangerous as the body responds. Days 7 through 10 can be the most critical in determining the likely course of his illness, he said over the weekend. There were also lingering questions about potential long-term effects to the Fat Ass, and even when he first came down with the virus, Conley had repeatedly declined to share results of the medical scans of Fat Ass 45's lungs, saying he was not at liberty to disclose information because Fat Ass 45 did not waive the doctor-patient confidentiality on the subject. But if you like the video, give the video a like and subscribe to my channel, Random Mike, and also hit the notification bell so that you'll be notified when a new video comes out, and thanks for listening.